Okay. Okay, Bismillahirrahmanirrahim. So these are the chapters you have to highlight in your AKP, right? And see, today we will discuss gastro, nutrition, neonate, palliative, renal, endocrine, eye, skin, metabolic, okay? And ethics, statistics we already discussed. Ethics we did not discuss. Ethics is safeguarding. We will discuss this today. And immunology we will discuss, okay? And infection chapter, there is one case that is HIV. HIV is excellently written here in this book, and HIV question you will get, okay? I have given you one PDF, UK, the England Society for HIV Infection and Management, right? I have given you that PDF, and also I have given you my handwriting notes on the HIV preparation. So you can take that preparation. Okay, so let us start from our class today. Before we start, do you have any question? Anyone? Those who are, especially those who are exam going? Okay, see, we discussed this one, respiratory, and we discussed the foreign body case. Now let us start from gastroenterology. Okay, you can open your book. Page number is case number 12. Okay, just open your book, case number 12. We will discuss this 12 today. Okay, 12 number case is a 3-month-old girl with diarrhea. Okay, now we have already discussed yesterday in our data interpretation class. There are how many types of diarrhea? How many types? Data question will come. Am I audible to you? How many types? Yeah, okay. So how many types of diarrhea we discussed yesterday?
2 types.
Yes.
Secretory and osmotic.
Yes, very good. And I hope you already know secretory diarrhea does not stop without, even if you
stopping
stop.
the feed. Yeah.
And osmotic diarrhea will stop if you stop the feed. In AKP, the question will be not so easy. Okay, in AKP, the diarrhea related question will be a little bit tricky, like stool pH. They will give you stool pH. They will give you hydrogen breath test. Can you tell me in which diarrhea hydrogen breath test is positive? We discussed one important diarrhea yesterday. I showed you the
lactose intolerance.
Yeah, very good. You remember there is a sweet smell, production of methane gas, and there was hydrogen ion, production of hydrogen ion, lactose intolerance. Okay, when the bacteria ferments this lactose in the gut to produce hydrogen. Hydrogen breath test is positive, right? Okay, so now let us discuss this case. So this is a 3-month-old. You can see your book, case number 12. Okay, this is a 3-month-old presented with history of irritability, vomiting, and diarrhea. And there was blood stained. Now tell me, cow's milk protein allergy, how many types? How many types of cow's milk protein allergy? We discussed many times in our class.
2 types.
2 types, very good. Yes.
IG mediated and non-IG mediated.
Very good, very good. Exam candidates, please answer the question. You will get such type of question. And as we know, in UK, every 4th child, among them, 1 child is allergic to something, either cow's milk or egg or nuts, okay, or dust, mite, pollen, okay. So this is very common in UK, especially they have hygiene theory. You know, they are very clean, neat and clean. They do not mix up with the environment much. So their capacity of growing allergen is more. They have more allergic disease in comparison to Bangladesh, like poor countries. They have more allergic disease. Okay. So cow's milk protein allergy is 2 types. We all know. Now tell me, One type is anaphylactic, causes anaphylactic, that is immediate, IgE mediated, right? Another type is which type? Another type is which type? Non-IgE mediated, right? So can you tell me what is the mechanism of non-IgE mediated? Why then it is allergy? Actually, this is not allergy, okay? This is T-cell mediated, okay? And you have to know that these two types of cow's milk allergy are very common. One type causes anaphylaxis, this is IgE mediated. Another type does not cause anaphylaxis, but they cause failure to thrive, irritability, loose stool, and bloody diarrhea. That is T-cell mediated. That is non-IgE mediated. Clear? So this case, the baby is irritable. The baby has irritability, vomiting, and blood-stained stool. She was born at term and birth weight was good. She was exclusively breastfed, and sometimes there was top-up formula fed. So largely breastfed. Largely means most of the time she was having breastfeed, but sometimes top-up formula was given. On examination, you saw the child is irritable, and her weight is on 9th centile. So we know from the growth chart that 9th centile is not so much good. She has small patch of eczema on her arms and legs. Her abdomen is soft, but perianal redness is noted. Now, perianal redness and perioral redness or rash, it indicates sometimes acrodermatitis enteropathica, zinc deficiency. But that will be from the very early stage. The child will be failure to thrive. The child will be, very severe diarrhea, usually not blood-stained. In acrodermatitis enteropathica, the diarrhea is not usually blood-stained. This baby looks like T-cell mediated cow's milk protein allergy. Okay, so which of the following is the answer? Answer is the cow's milk protein allergy, because there is blood-stained. And they did not tell us perioral rash. So we can rule out acrodermatitis enteropathica. Why not? This is congenital lactase intolerance. Because we already discussed in our yesterday class that lactase intolerance is not so common. It is very, very uncommon. Primary lactase intolerance is very uncommon. What is the cause of secondary lactase intolerance? Can you tell me from the yesterday class?
Post-gastroenteritis.
Yeah, viral.
Viral, yes,
Yeah.
mainly rotaviral diarrhea or bacterial diarrhea. After that, there is sometimes the mucosa of the gut is flat. So this can cause secondary lactase deficiency, and that is very temporary. We don't withdraw breast milk, right? So this baby is not lactase deficiency, not eosinophilic, not gastroesophageal reflux, and not diverticulitis. See, in gastroesophageal reflux, we know there is vomiting, irritability, but have you read anywhere it can cause bloody diarrhea? No. So this is not gastroesophageal reflux. Why not? This is Meckel diverticulum. Because Meckel diverticulum, the child will be blood is diarrhea, and the blood is very profuse blood. The child can go into shock. That Meckel's diverticulum, the child will be not irritable, not vomiting. Meckel's diverticulum, usually there is a tissue, okay, gastric tissue or pancreatic tissue that can be destroyed by gastric acid, and there is sometimes obstruction or sometimes bleeding, and this bleeding is profuse. The baby can go into shock. Okay, but here there is sometime occasionally blood mixed. It is not the feature of Meckel's diverticulum, and the child is irritable. In the Meckel's diverticulum, they will give you there is profuse blood. Okay, so this is not Meckel's diverticulum. The answer is, who is messaging in the group? Okay, during class, actually, I cannot see the message. Meeting ID. Meeting ID I already shared. Okay, see, so in gastroesophageal reflux disease, I will not find such type of bloody diarrhea. Okay, so see, cow's milk protein allergy, what is the treatment then? Now, second question, which of the following formula initially most appropriate in this section?
B.
Extensive hydrolyzed formula.
Yeah, B.
Hydrolyzed.
Okay, yes, extensively. See, goat milk and cow's milk protein allergy, they both are almost same protein, whey protein, casein protein, almost same. So goat milk is not the treatment of choice. Amino acid based formula you can give, but that is third choice. You remember, we already know that amino acid is the choice. Okay, sometimes we can give soy milk, but this is a 3-month-old female child. Soy milk usually we give at which age?
More than 7 years.
No, more than 6 months. More than 6 months, not 7 years. 7 years we don't give milk, right? So soy based we will give more than 6 months, and soy milk we cannot give in a male child.
Yes.
Why?
Hormonal problems, because I think.
Yes,
Yeah.
phytoestrogen.
Yeah,
This
testosterone.
PD.
Yeah, they have phytoestrogen. So this estrogen actually hampers the development of male genital organs, testosterone and male, it acts as anti-testosterone. That's why we cannot give soy milk in male child, okay? But in female child, you can give at 6 months, more than 6 months. So this case, in this baby, we will give extensively hydrolyzed formula. There is another formula, partially hydrolyzed, but we don't use that, okay? We use extensively hydrolyzed formula. GERD will not cause bloody stool, actually, will not cause bloody stool, okay? Blood mixed, you can say, blood mixed stool. So not fit here. And Meckel's diverticulum will not cause vomiting or irritability, so rule out, okay? Meckel's diverticulum may cause vomiting, but very rarely. They actually cause bloody diarrhea. Cow's milk protein allergy symptom is very varied, from failure to thrive to anaphylaxis. And IgE type hypersensitivity, we know that this IgE type hypersensitivity usually they develop within few hours of ingestion. Usually there is 2 types of reaction. One is immediate, another is delayed. Remember, every IgE anaphylaxis can happen even after 24 hours. That is called delayed reaction, okay? So how you diagnose this IgE type of hypersensitivity? Any food allergy, even nut or cow's milk, you will diagnose by IgE level, skin prick testing. Never you can do patch testing. Can you tell me for which disease we do patch testing? Patch, we give.
Dermatitis.
Sorry, again?
Contact dermatitis or TB.
Contact dermatitis, TB. Okay, TB, that is Monto test. Tuberculosis and leprosy, that is Monto test. That is not skin prick test. Okay, that is Monto. Monto is different. Skin prick test usually done for food allergy. But for drug allergy, what test you do? That is called patch test. Okay, there is some, some antibiotics are given in the patch, and that is given into the skin, and it is wearing for 4 to 6 hours to look at the drug reaction, because some children have penicillin allergy or azithromycin allergy, okay, like that. So remember that IgE type of hypersensitivity you can diagnose by 2 methods. IgE level, skin prick test by antihistamine, okay? So skin prick testing always you will give in a hospital setting. Skin prick testing cannot be done in an outdoor basis. Because why? Because it can cause so severe reaction, okay? Treatment is done by antihistamine. The treatment of cow's milk protein allergy, like suppose only rash. What is the treatment? Only rash. We will give antihistamine, chlorpheniramine syrup. This question came many times. Only rash. There is no feature of anaphylaxis. Okay, so you'll give antihistamine. IM adrenaline injection. IM adrenaline. When we give injection IM adrenaline, which component should be?
Respiratory difficult.
Respiratory. Shock. Respiratory.
Okay. Either cardiovascular or respiratory component, othoba or any of the 2 system involvement, like severe rash, severe diarrhea. severe rash, severe vomiting. These two symptoms, even these two symptoms can cause anaphylaxis. So you have to give IM adrenaline. So there is classification of anaphylaxis. Number one, there should be respiratory complaint like wheeze, stridor, breathlessness, apnea, tachycardia. These are the sign symptom of respiratory compromise. Second is cardiac compromise. The patient got pallor. Patient is in shock. Patient has low blood pressure or postural hypotension, or the capillary refill time is prolonged. Patient become pale. Patient become cold. Okay, that are all the signs of cardiovascular compromise. Now number 3. This number 3 point is very important. Suppose you don't have any cardiac component, you don't have any respiratory component, but you have 2 other component. Like you have rash and you have vomiting or diarrhea. That means 2 system involved. This patient can go into anaphylaxis anytime. So in these 2 types of patient, you will give IM adrenaline. How many times we can give IM adrenaline? Can anyone tell me how many times?
2 times.
2 times IM and third time IV.
Very good. 2 times IM adrenaline. Third time IV, that is not actually true. In the third time, you have to understand this is resistant. This child is resistant. So why the child is resistant? Is there any other pathology? This child might not be a case of anaphylaxis. This child might be a case of congenital adrenal hyperplasia, right? You are giving adrenaline, but the child is not improving. Check the glucose, check the respiratory system. Why the child is not improving? According to the symptom, if you read the pediatric guideline in our red book or green book, new one, green book, there is a chart, flow chart. You remember the flow chart in hypersensitivity chapter? There is some column, red column. Those red column indicate after giving 2 times of adrenaline, if the child is not improved, then you check the symptom of the child. If the child has apnea, okay, you do endotracheal intubation. If the child has stridor, okay, you have to give dexamethasone or you have to give nebulized adrenaline, like that. So depends on the symptom. Okay, anaphylaxis, if 2 times IM adrenaline is not working, then the third time management depend on the symptom. Okay, so the treatment is withdrawal of milk. This is every case. Suppose the child is exclusively breastfed, there is no cow's milk feeding, then what we withdraw? Then what we do? We withdraw the mother's cow's milk ingestion, right? That is also a cause of allergy. There is non-IG mediated, more commonly in the UK, but diagnosis is by food exclusion. How you diagnose T-cell mediated? This question came in exam many times. How you diagnose T-cell mediated? We diagnose usually by food exclusion. Okay, so mainly we will diagnose T-cell mediated allergy by food exclusion by suppose 4 weeks. I will exclude this cow's milk and I'll see the treatment effective or not. Mainly with bloody stool. So bloody stool, we know bloody stool is a T-cell mediated. It is not IG mediated. It can present if after 4 weeks with abdominal pain and failure to thrive. This child, there is a history of bloody diarrhea for a short period of time. So it is not IG mediated disease. It is actually T-cell mediated. And T-cell mediated disease can present even after 4 weeks. Okay, am I clear up to this point? IG mediated will present usually within 4 hours, 2 to 4 hours, but sometimes can present within 24 hours. But non-IG mediated will present